Hi there, I'm Dr. Stephen Phelan. Welcome to Dental Excellence. And for this video, I just want to point out one of the themes that I follow when I'm teaching about more complex dental cases or aesthetic dental cases. And that theme is that the wax up is the blueprint. I really believe that you need to begin with the end in mind, to quote Stephen Covey, if you're going to be thinking about doing more complex dental or aesthetic cases. And so I designed my diagnostic wax-up communication form to enable my ceramist to really have the vision that I have and that the patient has for the case. So I did share this with a lot of people when I was promoting my occlusion design course a couple of years ago, and I think it was really well received. People really liked the concept, and I just wanted to add this to my Dental Excellence video series. A concept of additive diagnostic wax-up as well is something that I first heard from Pascal and Michel Magnier, when I went to the first course they hosted at IDEA back about 10 years ago. And it was a fantastic course. I really just made me really think about aesthetics at a really higher level, just because of the level of beautiful dentistry that the Magnier brothers produce. And so when I spoke to Harold, my ceramist, Harold Heindel, about the cases, we talked about basically additively contouring the porcelain restorations based on the wax-up, and the wax-up additively contouring to the teeth so that we could, again, preserve more tooth structure and more enamel. Even with crown cases, I like to preserve as much tooth structure as possible and as much enamel as possible, so that if something were to break, I'd rather the veneering porcelain break than the tooth break at the gum line. So we try to preserve as much tooth structure as possible. So to do this, if you can, within the confines of the patient's overall smile design, if you can do an additive contour wax-up, that allows you to preserve more tooth structure. So additive contour wax-up is a really great concept. I would Google Dr. Pascal Magnier and read some of his articles about this that he's written with his brother, Michel Magnier. And this is a case that we did next to case report from the Magnier brothers. And I'll just share with you this case briefly. It's a patient that came in with a lot of erosion, attrition, and tooth wear. So the teeth are already somewhat prepared. Because of the amount of erosion and attrition on the teeth, there's no need for me to excessively prepare these teeth. There's no reason to. We need to additively build the tooth structure. And you can see the before model next to the diagnostic wax-up. And you can appreciate the amount of volume of tooth structure we're adding with this wax-up. And then we use that as the blueprint to make the provisional restorations, which are then the blueprint to create the porcelain restorations. So the wax-up, though, is the key. It's the foundation for creating these restorations. So here's the patient again, occlusal view. You can see all the wax being added to the before model. It's additive wax-up concept, additive wax-up concept. And so the wax-up is the blueprint. Here's this particular patient. And if you look at his before pictures, we didn't have to prepare the teeth a lot. The erosion and the attrition have prepared the teeth a lot. I had to prepare the teeth interproximally so that the jacket crowns would go over the teeth, because I felt there was too much facial erosion to really promote porcelain veneers. But jacket crowns, conservatively prepared, are a good option for a patient like this with this much facial and incisal erosion. So you look at the different views. Here he is before. Again, end-to-end occlusion from the wear and the movement of the teeth as the teeth wore. He developed more of an end-to-end occlusion as opposed to any kind of overjet and overbite. So we're going to open the vertical to create a bit of overjet and overbite. So he has a more normally functioning occlusion, and it helps with obviously the survival of our restorations, as opposed to having our restorations into an end-to-end occlusion. So there's a lot of good teaching points on this case, and I'll talk about this case in maybe a few other dental excellence videos. But the bottom line for this video is the wax-up is the blueprint. So you look at, again, before pictures. Looks like bruxism if you were to look at the way the wear facets line up. Looks like bruxism. The wax up again was the blueprint to create the diagnostic, the provisionals, the diagnostic provisionals. So you look at the provisionals, we've changed the length of the teeth, we've changed the tooth volume, and we've changed the occlusion. We've opened the vertical, created some overjet and overbite, and maintained a pretty flat occlusal guidance scheme though, just because of his previous guidance scheme with the wear. And so look at the before and after change just by adding plastic additively in the mouth, you know, with the provisional restorations. So here he is with his provisional restorations. And then what I said earlier is we create the final restorations based on the provisional restorations. The provisional restorations were created based on the diagnostic wax up. So we are, again, using the wax up as the blueprint. So here are the restorations. These are lava zirconia crowns, layered lava zirconia crowns. You know, this case was completed about 4 years ago. The restorations are by my ceramist, Harold Heindel, from the Seattle area. He's a master dental ceramist. Beautiful anatomy, beautiful layering of the porcelain. But for me, the keys are beautiful fit and beautiful occlusion. Beautiful fit and occlusion. Those are the keys to make my life easier, as well as the beauty and the aesthetics. So there's the before and after of the close-up view. And you know, it's a huge change for this patient. It's a transformational change, really, when you look at what this does to the overall appearance of the person's just overall face. You know, it makes almost everybody who has a before and after change like this look tremendously younger. It's just, you can't help it because you've changed the whole part of the face that people look at the second most. They say that people look at the eyes the most, and then secondly, the teeth and smile. So, you know, this is transformational, I would say. And these photos were taken a while ago. They're the 3-year post-ops. You can see the case is held up exceptionally well. Case is held up exceptionally well, but we did a very nice occlusal design, very precise and thought out occlusion design for this particular case. Thought out in a precise way that I talk about every time we discuss my occlusion design course. You know, just the different things that we look at with overjet, overbite, angle of guidance, pathway of guidance, as well as degree and width of guidance. So just some more views. Natural looking aesthetics. These are zirconia restorations, but layered in such a way that they can look very natural. And the final view. And I'll just end by saying that you can do this kind of dentistry. You know, I have an everyday practice. I just really document well, and I work with a great ceramist. So I'm fortunate that way, obviously. But you can do this kind of dentistry. Beautiful dentistry with precise fit and occlusion is not just for the gurus.